Well, Nigeria is celebrating the announcement by the UN Health Agency that polio is no longer endemic in the West African country. The Global Polio Eradication Initiative, the public-private partnership leading the effort to eradicate polio, called this a historic achievement in global health. 20 years ago, Nigeria was recording 1,000 polio cases a year, the highest in the world. Nigeria has not reported a case of wild polio virus since July 24, 2014, and all laboratory data have confirmed a full 12 months have passed without any new cases. As recently as 2012, Nigeria accounted for more than half of all polio cases worldwide. Now, for more insight into how Nigeria did it and what must be done to completely eradicate polio, Dr. Frieden, Director of the Centers for Disease Control and Prevention and Chairman of the Polio Oversight Board, joins us live via Skype from Atlanta, Georgia. Dr. Frieden, welcome to Africa 54.
Thank you very much for having me. It's a good day. It's real progress in Nigeria and Africa, but also remaining challenges.
Indeed, Doctor, many are saying, how did Nigeria do it eventually after such a long struggle?
There were many aspects of the success. One was political commitment at every level, including governors of key states. The second was the use of what are called emergency operations centers. These are not just places, but an organizational means of ensuring that we track every task that has to be done and we coordinate among all of the partners who are involved. And then also at CDC, we worked closely with Nigerian doctors and other health workers to do what was called NSTOP, National Stop Transmission of Polio. And we put more than 250 staff in all of the districts, all of the LGAs, the local government areas, where there was continued spread of polio to allow them to rapidly improve immunization services. These were really key. And with these innovations and with hard work on the front lines, it does appear that Nigeria has gotten over the finish line.
Now, Dr. Frieden, you say, well, it's no longer in the list of endemic polio countries. What does that mean, and what do you do to completely eradicate polio in Nigeria?
It will take 2 more years of careful, meticulous tracking to make sure that it's not hiding somewhere in a case here or a case there. I was in Nigeria recently. I was impressed with how good and robust the surveillance system is, but it'll be another 2 years before we know for certain that it's out. And the rest of Africa needs to ramp up surveillance to make sure that there's no polio anywhere in Africa. It does appear that for the first time in human history, Africa may be polio-free, but unless we strengthen surveillance even further, we cannot be certain of that.
Now, very briefly, can the lessons learned in Nigeria be applied in particularly the countries that still report those cases, Pakistan, Afghanistan, for example?
I think there are a couple of big fallouts from this. One, Nigeria now has 2 real successes in the past year. The first is no more endemic polio. The second is using that polio system, that polio infrastructure, to stop the Ebola outbreak in Lagos. It's quite possible that the situation would be very different if the polio system hadn't been available to stop Ebola. And with those 2 successes, there's now more pressure on Nigeria to do more about malaria, family planning, maternal mortality, HIV, other serious health problems there, as well as, of course, all immunizations and vaccine-preventable diseases. Pakistan and Afghanistan are now the last 2 countries in the world to have endemic polio, and all eyes are on them to protect children there so that this can be the ultimate for all children everywhere, forever.
Dr. Frieden, such a delight talking to you. Thank you very much.
Thank you.
Dr. Tom Frieden, the director of the Centers for Disease Control and Prevention, who joined us from Atlanta, Georgia.